Hey everyone, Dr. Charlie Johnson, physical therapist and back pain specialist. In today's video, I want to talk about the God's honest truth about spine surgery. So it just amazes me that people go to see these spine surgeries and they're recommended to have spine surgery when we know that 95% of the time these spine surgeries are completely useless. In fact, if we look at 10 people and we follow them who have had spine surgery, we look at them 5 years out, we know that 4 of 10 of those people who have had spine surgery will have to have a second spine surgery due to other areas of the body just sort of breaking down. Because once you hold something in the body, well, something above it and something below it has to move. The body's really smart, it figures it out, and it stresses out other things in the system. And people go to these orthopedic specialists and these surgeons. The surgeons spend 5 minutes with them. They don't go through a good examination, and then they're making the call based off a static picture, which these problems don't hurt generally when people are sitting still. They hurt when people are moving and going about their life. So they assess something that occurs when somebody moves, and they just decide to put somebody in a little cube, take a picture, and then they point it up there, they show a disc bulge, and then for some reason, I can't figure out why, people believe them. And then they're in worse pain and disability following the majority of these spine surgeries. So again, 95 to 98% of these spine surgeries are useless, and this is just the truth about it. There's a very large sort of demographic study. It looked at a lot of different people across the country, and they found the biggest predictor of spine surgery was not how bad the MRI looked. It wasn't, oh my gosh, your back looks so bad, you have disc bulges, you have arthritis. None of that mattered. It was actually your zip code. So, basically, as more surgery centers pop up here in southeastern PA, the likelihood that one will have spine surgery goes up and up. And compared to most other surgeries, spine surgery is reimbursed the highest. So, it's a big business, and people aren't aware of it. They just trust the expert, and they don't inform themselves. They don't ask questions as far as like, hey, how do we know that what we find on this image wasn't just there 10 years ago, and now we're just picking it up because we're taking a microscope to my spine, right? And we know that's actually what happens a lot of times. A lot of these things are just normal changes. They're not asking like, hey, what are the outcomes of spine surgery? So what are the chances if I have this? This is any better than conservative natural treatment with a top-notch physical therapist. And there is no difference. And not to mention that what are the side effects? What is the possibility that I could die? What is the possibility I could get an infection, a blood clot? And what is the possibility that 5 years down the road that I'm going to have another surgery? And what is the possibility that doing this, or the probability that doing this will actually solve my problem? And if people knew the truth and the answers, which is basically we don't know, and yeah, all those ugly things are possible, and oh, by the way, these things are no better than just not doing this and going back to PT, then people wouldn't do it. But it makes surgeons and big health systems a lot of money, and it's just unethical, if you ask me, on their part. So people look at surgery as sort of the end-all, be-all fix, as if we're all driving around and we're cars, right? And we can just be fixed that easily, and it's not, because pain is an experience that's created by a bunch of other systems and things, and it's not something that can just be fixed. You can't just change out the brake pads on grandma and she's going to be good to go. It just doesn't happen like that. It takes work to get into the problem. Something got people there. They have to work to get out of it. This quick fix stuff is insane, and it's crazy, provided we know the outcome. So yeah, it's like people are just like, well, if I do X, Y, and Z, then surgery will save me. And people should be thinking of it the opposite way and being like, hey, I have to make X, Y, and Z work to its fullest potential because surgery is no better than these things. So surgery is not the end result. That's the end of the rant there. But when is spine surgery needed? So as much as I'm against it for 98% of the people, in about 1 to 2 to maybe 5% of folks, spine surgery can actually be useful and may be needed. So here's the other side of the equation. We know that the major indication for surgery, and pretty much the only indication for surgery in about 1 to 5% of people, is true damage or loss of nerve function, meaning like the nerve is actually dying. So, if you try to go up on your toes, you have significant weakness, or if you try to poke yourself with a pin, you can't feel it, or if you're losing control of bowel or bladder function, right, and the health of the nervous system, is going down the tubes, and we need to change that. We need to change that by decompressing the nerve or surgically removing whatever is putting pressure on the nerve. But it's so rare. So the true indications are loss of feeling, strength, and then bowel or bladder loss. So wetting your pants, inability to empty when you go to the bathroom, whatever. Those are really the only times, again, 1 to 5%. Everybody else who just has pain, back surgery is useless. Not going to be helpful in the majority of cases. In fact, the outcomes are not supportive of it at all. It's not just my opinion. That's what the research and the studies show. So again, 95% of people who are having back surgery probably shouldn't really be having it. And pain, people are going to have back surgery for pain. And the indication for surgery is not for pain. It's for function of loss of nerve function. The nerve is dying and we need to bring it back to life. We need to decompress it so that it can breathe. Pain is not an indication. If somebody's getting back surgery for just some low back pain or arthritis or something like that, the chances that that's going to work out well are probably just as good as a flip of the coin. Which, if you ask me, something that invasive, it's not worth it, all right? We know that people who have spine surgeries are less likely to get back to work. They are more likely to be addicted to things like painkillers, and their outcomes just suck overall. So, with that being said, we looked at people who had raging leg pain, sciatica, but they didn't have any loss of nerve function, no loss of feeling, no loss of strength, no loss of bowel or bladder control. And we took these people, we want to say, hey, if these people do surgery, if they don't do surgery, what are the outcomes after 1 year for pain? This is pain, this is 0, this is a scale, hopefully you can see this, and this is time. So this is 12 months, 6 months, and the people who had surgery relieved their leg pain quicker than the people who had PT. Here's PT, but not by much. At 6 to 12 months, the people who just had surgery for terrible leg pain, the outcomes were exactly the same. And notice, in the surgical group, there's more risk there, right? And in the non-surgical group, the worst that happens is that you learn a heck of a lot more about the condition. You lose some pounds while you're getting back in shape. You learn about the body and how it works and things that you can control and can't control, and it puts you and empowers you to grab the bull by the horns and get back to your life. Even if you do have some discomfort, it coaches you into a new possibility and position such that you can live a better life even if there is still some back discomfort. It doesn't work to fully heal it. The only option here is you go, somebody does something to you, and then it's just like wham bam, they pat you on the rear, you go back to your house and you still keep doing all the same stuff that led to spine surgery. And this is why the outcomes are poor. So for anybody out there who's watching, a strong message here for you. Surgery is worse than useless for 95 to 98% of back problems, yet spine surgeons get paid a lot of money to do them. The biggest predictor of spine surgery, zip code, is not how bad the x-ray or how bad the MRI looks, none of that. You would think, right? So as much as we'd love to say it's being done in the best interest of the patients, there's some evidence that suggests otherwise. And you just want to be aware of asking the questions, being very critical of the decision to have a spine surgery. What are the indications that I need it? What does the research show about me doing this versus me doing, say, PT and continuing that? What's the probability this is going to solve my problem? And long term, what are the results of doing something like this? And then what are the side effects, right? And if you pro and con that, right, maybe you still do it, sometimes I still do it, but when I was younger, my mom had me write a pro-con list. This is such an obvious decision. Even though people are in pain, they're looking for relief. If they knew the stats and they knew the facts, as I'm sharing here, right, the pro of doing conservative treatment, right, is just like huge compared to, a huge list of cons compared to the pro for doing surgery. So for anybody out there who's looking for natural relief and wants a non-surgical second, opinion from somebody who can step back, spends more than 5 minutes with you, and go through a full, complete examination, really give you the big picture, 30,000-foot view of what's going on and the best ways to manage this, then call 484-552-3767. Thank you.